Hello, I'm Dr. Bill Waggoner. I've been a pediatric dentist for nearly 35 years, 15 of those years in an academic environment and the last 20 in private practice. Today, my associates and I operate 3 pediatric dental practices in Las Vegas. In addition to practicing clinical pediatric dentistry, I still often have the opportunity to give presentations both nationally and internationally on topics related to pediatric dentistry. Today, I'll be speaking to you about a type of digital radiography that I found especially effective for pediatric dentistry and which I've used for nearly 10 years. ScanX flexible digital sensors, also known as ScanX phosphor storage plates, manufactured by Techniques. The small, soft, flexible ScanX sensors are comfortable for nearly any pediatric patient, which is something that isn't true of hardwired sensors. The image quality is excellent, and the image processing time is a fraction of the time it takes to process film X-rays. And ScanX technology offers many other advantages, which we'll discuss shortly. When I first started my private practice career nearly 20 years ago, we used exclusively film radiography. After 2 or 3 years, I decided to go digital and invested in a wired sensor system. It didn't take long for me to realize that a large number of children were not able to tolerate the hard sensors. So, after a few months of trying, we went back to film. Several years later, I investigated the ScanX phosphor plate system and realized that if a child could tolerate a regular film, they could certainly tolerate the phosphor plates. So both of our offices purchased the ScanX Classic unit, and we got rid of our film developer years ago. The ScanX Classic is a real workhorse, as it accepts size 0 through 4 intraoral plates, panoramic, cephalometric, and TMJ sizes. Techniques also makes a smaller unit called the ScanX Intraoral. It's for practices that use a digital Panorex or have only intraoral imaging requirements. It accepts all the intraoral sizes 0 through 4, and like the ScanX Classic, the ScanX Intraoral can process images from up to 4 sensors simultaneously. The smaller ScanX Duo unit also accepts sizes 0 through 4 and is ideal for practices that normally need to read images from no more than 2 sensors simultaneously. Recently, Techniques introduced the ultra-compact ScanX Swift, which is particularly well suited for pediatric dentistry. In fact, let's take a look at how convenient the ScanX Swift can be for a pediatric practice. First, using the ScanX software, which integrates easily with our normal practice software, my assistant indicates which sensor she's using. Next, she places the ScanX sensor inside a barrier envelope and seals it. Then she places the sensor in the patient's mouth just like she would with regular X-ray film. She then exposes the X-ray image. Note that with the ScanX, the X-ray exposure can typically be 80 to 85% less than what's required for X-ray film, which is something your patient's parents will appreciate. She removes the sensor from the patient's mouth, removes and discards the barrier envelope, and inserts the sensor into the ScanX Swift processor. As you can see, the ScanX Swift processes the images in literally seconds, only a fraction of the time it would take using film. The phosphor plate is also automatically erased as it's scanned. The assistant views the scanned image immediately and can determine if she's captured the desired image. With a couple of keystrokes, she can then save the scanned image into the patient's electronic chart using our regular imaging software. Notice the large image area, which is up to 38% larger than you'd get with a wired sensor. This ensures that you're much more likely to capture the complete coronal to apical length and not miss a root apex or distal cusp. And that, of course, means fewer retakes, which is another time saver. In addition to the larger image area, ScanX also gives you excellent image resolution. If treatment is indicated, this impressive image will help you show the patient's parent the extent and the location of the problems. Brightness and contrast can easily be manipulated, and areas of the film can be magnified for better viewing and diagnosis. If I had to pick the most important reason for using the ScanX Swift, it would have to be the fact that, unlike with hardwired sensors, which are difficult for many children to tolerate, ScanX sensors can be used with 100% of the children who can tolerate regular film X-rays. ScanX sensors are 30 times thinner than wired sensors, so they'll fit even the smallest mouth, and they're also wireless. But there are many other advantages to the ScanX as well. First, unlike film, you don't have to deal with and pay for costly film packs and messy chemicals, or deal with the hassle of chemical disposal. Also, as I mentioned earlier, ScanX's digital images can be enlarged or manipulated in any number of ways, including adjusting the brightness, contrast, or size. They can also be stored and transmitted digitally, rather than having to be stored in bulky cabinets, sent through the mail, and physically stored in the patient's charts where they often fall out when the chart is open. And there's no need to regularly clean and maintain a film processor, which is a job that most office staff would happily like to forget. In fact, when we recently opened our third office, I was planning to use regular X-ray film because I had a working film processor and I was trying to minimize our expenses in opening the new office. However, within about 3 weeks of opening and dealing with films and a contrary processor, I told the staff we were moving to digital like the other offices and that we were getting a ScanX Swift processor. My lead assistant literally hugged me and said, "Thank you so much, you've made our lives easier." ScanX sensors are a fraction of the price of hardwired sensors and can be reused hundreds of times. There's also no need for costly insurance or annual maintenance. When you add that to the fact that you don't spend a penny on film or chemicals, ScanX really delivers an outstanding return on your investment. And in the case of the ultra-compact and ultra-affordable ScanX Swift, the return on investment is really exceptional. Based on my personal experience, the ScanX Swift is an ideal digital radiography solution for pediatric practices. Thank you for letting me share that experience with you today.